And I'm Dr. Funke Afolabi-Brown. For those who have never met me, I think our guest is coming on soon. So as I was saying, I am a sleep physician. I'm the founder of Restful Sleep MD, and one of the things I'm really passionate about is helping
Hey,
families. Hi,
here
how
we
are
are.
you? I was
Good. How
just
are you?
kind of hanging out with our friends here. Good to have you. So
Awesome.
maybe we'll start off with some introduction so we could get to the meat of this.
Sure,
Thank you
sure.
so much, Serenity Sleep Consulting. We're excited you're here. We're excited to be here. We're going to be sharing really, really good information, even if I'm biased. Right, Dr. Anya? Anyway,
Yeah,
for those who don't know me, I'm Dr. Funke Afolabi-Brown. I'm the founder of Restful Sleep MD, and I am passionate about helping women and children prioritize sleep so they can live the lives of their dreams, right? So I have a very, very good friend, and by very good, I mean really, really good friend who shares so many incredible passions as well, and our paths have crossed, and it's just been incredible what this space, this virtual space has really created for both of us. And so we've had a live in the past before, and we got incredible feedback. I still get people, I have it on my YouTube channel, and I still get people referring to it. And so definitely, maybe I'll link it in this as well, so you
yeah,
guys can
yeah.
can watch it. But it's good to have you. Let me have you introduce yourself, Dr. Anya.
Sure. Thanks a lot. And I would say that the world of technology and the virtual space has been amazing because that's how we connected. Like we haven't actually met in person, but we speak often, and you've been like such an invaluable, encourager and just, like I think when we talk, a lot of aha moments and like light bulbs go off because we share such a common passion. So it's just a pleasure to be here today. So yeah, I'm Dr. Anya Maclaren Barnett. I'm a pediatric respirologist and sleep medicine physician who basically sees everything in terms of issues related to breathing, issues related to sleep, and so it's my pleasure to be here to chat with you.
Awesome, awesome. Yes, and where are you based? Let's know
Sure.
where you
Yes. So I'm in Ontario, which is just north of the States in Canada. And I work in a tertiary care center, and I also work in the community, doing sleep.
doing amazing work, and we can see that based on just what you share with us. So really, let's dive in, right? One thing I put out there when I put out the flyer for this talk was the fact that pediatric sleep disorders can be as high as 40%, if not more, depending on who's sampling what,
Yes,
right?
yes, yes.
Yet, I just feel like we are just even still scratching the surface because, as you and I know, there are not too many people like you and myself that do the work we do. So we're
Yeah,
just not able to see everybody. And many times, families just struggle with sleeping their kids, and they feel that, well, hopefully the child would outgrow it, or I guess this is my this is my lot in life, or something of that sense, and they feel so disempowered, right? And so I think really I wanted us to shed some light. And sometimes some families don't even realize what sleep disorders are. They
yeah.
see their kids maybe acting out during the day, maybe struggling with sleep, but really not understanding that these are things that are actually fixable, these are things that are treatable. So
Right.
maybe we could even start with that. Like what are your thoughts on that, on
Yeah.
just how high that prevalence is?
Yeah, no, I agree. And I would say that I think because it's so like sleep issues in children are so common, it's almost
Mm,
normalized.
mhm.
And it's even more normalized in the families that have kids who are neurodivergent or children who have chronic medical illnesses. And it's almost as if it's just accepted that,
Mm,
having a child between, I mean, even even when they're teenagers, it comes with sleep issues. And I think that I would agree with you that, parents need to be empowered and they need to be educated in order to advocate for, sleep and normal sleep for their child. I think that just like how we talk about, I remember when we did our last live, we spoke about how sleep is like a fifth vital sign, right? So,
Mm,
when kids come in to see physicians, or nurse practitioners, talking about, you measure their blood pressure and you check their heart rate, you should also be checking their sleep.
mm,
We know that children between 0 to 5 years of age spend more time asleep than they do awake. And
mm,
even go, into teenage years, it's at least 40% of the time. And so, or it should be anyway. So,
mm.
so yeah, no, I definitely agree with you that there is, sleep issues and sleep conditions in children are prevalent. I think that, the education that parents or families have around what normal sleep is lacking. And I think that because of that, it's accepted that, a child is not sleeping well, and that's just the way, that's just what childhood is
Mm.
about.
And that's why we're here. We're here to change that, right? We're here to provide the right information, because when we know better, it creates that sense of awareness.
Right.
And like you mentioned, it helps you as a parent, or if you're even a physician, or you take care of patients, or you have clients with sleep issues, it helps you to know exactly what to look out for.
Yeah.
And when I really got into this space, a lot of the things I was hearing around sleeping kids was sleep training. That was it. It was like, okay, sleep issues, sleep training, and then that's it. But we know there's a lot more than that. So maybe what we could talk about right now is what are just some type of sleep disorders? Like, how are we employed? How do we get right? How do
I
we get a
know.
livelihood, right?
Yeah,
Because if it was only sleep training, I'm not sure that we would be able to stand that long. But there's a lot more to sleep issues in kids beyond
yeah.
issues that are solvable by sleep training. And so I just wanted us to talk about that.
Yeah, sure. I mean, I would say that, and I think it's probably the same for you, that by the time kids get into our
Mm,
office, they've gone, like, typically have to get a
mm,
referral from a family doctor or a pediatrician, or a nurse practitioner. And so, what I actually see, I think is probably just the tip of the iceberg. I'd start by
mm,
saying that. So, I mean, I see anything from, a lot of sleep disordered breathing issues, a lot of insomnia issues, issues with restless leg syndrome, issues with abnormal movements during sleep, issues related to, parasomnia,
mm,
sleepwalking and sleep talking. And so I think, I coming into this space, and I think after being in practice for a few years, it became really apparent to me that, um, what I see is just a fraction. And I think if we think back to, a child who, like any child, it first takes recognition from a parent to bring it
mm,
to the attention of a family doctor or a primary care provider. And then it takes, the action on the part of the primary care provider to get it through to a sleep specialist.
mm,
I think there are not enough sleep specialists, that exist. And so, I think that probably what I see and sample, and I mean, I see many children per week, year in, year out, but I think that, it really is just a fraction.
mm,
And so, but yeah, I mean, everything ranging from babies who aren't able to sort of sleep through the night, all the way to teenagers, who may have circadian phase delay, and, all the way to children who have ADHD and may not necessarily have discernible sleep related issues, but they end up coming in because of issues with attention and hyperactivity. So
mm,
I would say it's a combination of, behavioral type issues
mm.
that potentially could be related to sleep, as well as primary sleep conditions or sleep disorders.
Absolutely. Yeah. Yeah. And I usually use these three categories, which I learned from Jody Mindell, who is my mentor. Um, we talk about like those, just like you said, the behavioral sleep issues, and there's a lot within that bucket. I feel like that 40% to 50% we're talking about really fits in that bucket,
Yeah.
honestly. Like, the kids that are like having a hard time settling down, the kids that are waking frequently, the kids that need another hug or whatever that is, it's there. And then there are the medical sleep issues, which are the sleep apnea, like you talked about, restless leg syndrome, narcolepsy. While those may seem small, quite a number of children go undiagnosed for so many years because people don't even know to look out for those issues, right? And then there's the third sort of bucket that you alluded to, things like ADHD or autism or anxiety, mood problems that also can manifest during sleep or as interrelated or connected with sleep issues. So I think really helps you see that there's such a wide gamut, and I think we really are scratching the surface in our practices when it comes to how many we're able to see at once.
Yeah, yeah, no, I agree with you 100%. Yeah, yeah.
So now, how do you know, or why, maybe the why is it important? Like, so even if a kid has sleep issues and sometimes they even go to the pediatrician or go to their primary care provider and they're told, well, just you know take away the iPad during bedtime, good luck, right? Like, why is it important that parents start to pay attention, that providers start to pay attention to these sleep issues?
Yeah, I mean, I would say that more and more we are learning, and what we know about
Mm,
sleep, is much more than what we knew 20
mm,
years ago, and it's very clear, very apparent that sleep is an important pillar of child growth, development, learning, and I think that. I've always sort of viewed my role as a pediatrician to facilitate or, help kids maximize their full potential. And I think
mm,
sleep is just one really important part of that. And I think coming being in practice and out of training for the last few years and recognizing that there is this huge gap
mm,
is really what has empowered me to really ask myself the question and ask my colleagues the question, is there more that we could be doing?
mm, mm. Yeah, absolutely. And I was even looking at some studies recently. I'm preparing for a talk coming up, and we're looking at parent sleep and kid sleep and just the impact that the child sleep has on the parent sleep, and it's huge. So when we have parents who are struggling with either insomnia, stress and anxiety that's getting in their way of sleep, or other sleep issues, and it's manifesting in impaired daytime function, sometimes helping with addressing the child's sleep improves the parent's sleep. And that's really the core of the work I do, because I realize that as kids sleep better, the parents hopefully are now
Yeah,
able to
yeah,
focus on themselves and get the sleep they need. So this is not just even beyond the child's learning, development,
yeah.
health, mental, physical, emotional health. This is a
Of
society-wide problem,
of
right?
course.
Because if you have that sleep-deprived mom that is showing up at work after dealing all night long with her child sleep issues, guess whose job is going to suffer, right? Her job is going
Yeah,
to suffer, her productivity is going to suffer, the bottom line is going to suffer, right? So at the
yeah,
end of the day, fixing or addressing this or paying attention to what seems to be like maybe it's not such a big deal, has so many repercussions on so many levels. So I definitely feel that this work is so important and it's so vital.
yeah. And you know what? I mean, Funky, what I'd also add to that is why I think that the work that you're doing is amazing, because I think that definitely the societal impact and many downstream impacts are so important, but
Mm,
also like our ability to parent,
mm,
hinges on our like us being in the best health. And I think we'll talk a bit about the program that I'm preparing, but in preparing that and looking at all the
yeah.
data about attachment and just parenting and sort of temperament and how to manage different temperaments of children, like our capacity to be able to
Mm,
do the daily things that we need to do as
yeah.
parents is it relies on sleep. And I mean, and you also probably appreciate that. I remember when I was on mat leave and going back to work after my second one was 8 months, and it was like, yeah, it's a big thing. Like it's a big thing for sure.
Yeah, yeah. And Canada, you guys get what, 6 months, 8 months, 1 year? We had 2 months. So you can imagine how that
I
takes a
cannot.
toll.
I cannot imagine it. I cannot imagine it.
Anyway,
It's
we
hard. Yeah.
digress. We could literally have a whole live on maternal or the effect of child sleep on mother sleep, but I really want us to focus on this. So we'll
Yeah.
bring it right back. So how do we move forward? When would you say, okay, this is beyond what the pediatrician should be really addressing? When should they know to either refer? How do they navigate all this? If a child presents with whatever those sleep issues are, when do you think what would be the sort of the triggers to say, okay, you either should see a sleep specialist or we need to start to pay attention to this or that certain,
Yeah.
those certain issues?
Yeah. For me, and even I remember as a pediatrician, before I trained in respiratory medicine and sleep, a parent being concerned is enough.
Mm.
A parent coming into the office and expressing concern about their child's sleep or any issue is enough for me to take it seriously, right? I think taking it seriously, asking questions, and doing my own sort of preliminary assessment, and so I think that is what care providers should do. If a parent is really, concerned about sleep and has concerns and questions, then it should be addressed. And I think there's a lot that goes into that, educating the parent and normalizing sleep where it is appropriate. But if it is something that a primary care provider is not familiar with, or there are red flags, then definitely the child should be referred for further investigations and assessments.
Yeah, I love that. And I think that's the thing. And even when we define insomnia, the way we define insomnia in children, it's very different from how we define it in adult population. Because one of the things that we take into consideration when it comes to insomnia in children is the fact that the caregiver
Exactly.
has issues or concerns or problems, or the caregiver is not sleeping. Even if that child seems to be otherwise doing okay, then
It's
we really
important.
it is important to pay attention. So thank you so
Yeah.
much for highlighting that.
Yeah.
So now we already said, okay, the issues with sleeping kids, it's important to address those sleep issues because the entire society will benefit from it. I'm a little biased towards moms. I need my moms to sleep well, but I'm just going to leave it there. But then there's just a few of us. So how are we supposed to do that? So I just want you to tell us a little bit about the sleep gap. Like, what is the sleep gap, and
Sure.
why did you create this initiative?
Yeah, so I learn more about the sleep gap every day, to be honest. But how it actually started is again, me being in practice and recognizing and realizing the limitation in terms of sleep specialist services in Ontario. I can only speak to Ontario.
In the
And the
US
volume.
as well.
Yeah.
Everywhere.
Yeah, the volume of referrals that I would receive, and also a general sense that coming from the primary care providers, there was a general sort of discomfort with doing many, like, basic sort of assessments and management. And so I started to look at the sleep space on a larger scale, right? And so anyone that provides any sort of health or care to a child is really someone in the sleep space. That includes doulas who work with families, who, or moms that have given birth, and midwives, nurse practitioners, sleep consultants, primary care providers, pediatricians, and even pediatric subspecialists. And so I think the sleep gap really describes the fact that there is a deficit in knowledge and skill set to actually assess kids for sleep related issues and manage them. And so my sleep gap account and my idea, which I think it's been about a year now, was really founded to see with that question of, like, what can we do in this space, and how can we try to narrow that gap, or close it, so that we have a very sort of really efficient process where we're able to really deal with the issues that can be dealt with at the primary level, and then really just bring the difficult ones, or the cases that are not really manageable at that level, to specialist care or attention. And so so that's sort of what the sleep gap is about. And that's some of my work on Instagram, but also in my day-to-day is really about trying to educate parents and educate providers about sleep and sleep health.
That's incredible. And you know what? It's a big mission, but then I think we have to address it,
Yeah.
because like we said, this is really something that's so important. And so another question I had for you is what what is, I know you started the sleep health, I don't want to, it's the SHIP. What is the SHIP? Because we have the sleep gap, which is meant to bridge that gap.
Yeah.
And it sounds like one of the ways you're planning, you're going to bridge that gap is through this program called the SHIP, which I have seen you on Instagram. It looks phenomenal. And what you said about the sleep space, right? It
Yes.
is, the sleep space is for anybody that's really taking care of kids, because
Exactly.
bring any case, any
Yeah.
condition, anything at all child might be doing, there's a way we'll be able to connect it to sleep one way or the other. So
Yeah. Yeah.
technically we're all in that sleep
We
space.
are, and I think
Yeah.
I think we have to acknowledge and take responsibility for the fact
Yeah.
that we are, caring for children involves being able to have the information about every aspect of their overall health, and sleep is a huge one. And so so the SHIP is so originally when I started the sleep gap, I was navigating through, and I guess it's the same with anyone who, or any physician that comes into this space, right? Because it's very different from what we learn traditionally in medical school.
It is.
In medical school, and then in residency and fellowship, and further training. But so when I started to sort of own this platform and find my voice, one sleep consultant had reached out to me and sort of said that, asked me if I had any courses or programs, and I didn't, obviously, at the time, and I did a bit of market research, and that's basically what led to SHIP, which is a program that was created to bridge the gap between sleep consultant education and skill set as they navigate families through their own sleep journey. And so the program is really focused on helping to really delve into a lot of the evidence and research, because there's been such a huge exponential growth in pediatric sleep health research. So it's really aimed at equipping pediatric sleep consultants with the evidence-based information for things that they do in their daily practice and things that they may not currently do, and then also to really delve into how non-behavioral sleep conditions can look sometimes similar to behavioral sleep conditions, which is the majority and the bulk of what they actually see. And then, educating them about that, educating them about red flags, and helping to give them the information to educate families, to empower families, to really navigate the medical care aspect of things and the medical system to get what their child might need from a sleep health perspective. So it's like a passion project, and I've been working on it over about almost a year, and it's really exciting. I've been getting a lot of really great feedback about it, and I know that it is going to be really transformational for sleep consultants, and I know that it will be transformational for families as well.
That's awesome. So it sounds like it's mainly focused for sleep consultants. And why did you pick? Because, like, you're right, you could have decided to educate the entire world, and it's hard to do that. But
Yes.
you chose to focus on one group of people within the sleep space. So
Yeah.
why did you decide on sleep consultants?
I actually, and before, before I came into this space, what I'll say is I've learned a lot about sleep consultants and the work that they do. And what I've learned is that they're passionate about their job. And I mean, they're support systems for kids, but also for parents.
Yeah.
And as a sleep specialist, who sees kids every day, I personally, my view on sleep consultants is that they are partners. They are partners for physicians, partners for me, because they are able to do a lot more hands-on work with families. And some families need that. Not every family does, but there's some families that need that. And so I welcome them into the medical space and into, the medical health space, because I think that they're important players in sleep health. And I think that, I know that they're an unregulated group and that their certification programs, maybe different programs are, have different certification criteria and certification content. But I think that if we are able to, partner with sleep consultants, pediatric sleep consultants, and really provide some education around, red flags around non-behavioral sleep issues, I think they can be hugely impactful. And really, I think at the end of the day, when parents are concerned about their child, that anxiety, as we mentioned, it impacts their sleep and it impacts their ability to parent. And I think being able to have access to a sleep consultant who has the education to help navigate them through that is invaluable. And so the point is that, unless things change dramatically, there's always going to be this deficit between pediatric sleep specialists or physicians and, pediatric and, the volume of patients that, or kids that need our support. I think that sleep consultants can help us with that and can partner with us in that. And so, I know in general, in the medical space and in the medical community, they're not embraced. And I'll just sort of speak very openly about that. But I think that it's a missed opportunity among physicians.
I love all of that. And I think, honestly, when I started in this space too, that was something I realized. It almost felt like, people's lives, some parents' lives, many parents' lives, many families have been changed by, through the help of sleep consultants. I think helping to sort of bridge that gap, like you said, there may be conditions, and I've been on quite a number of podcasts where I have been interviewed by several sleep consultants too, to talk about melatonin and when to recognize a sleep disorder, right? Because there are things that you may not be able to navigate through if a child has an underlying sleep disorder. And so these are, of course, they're a lot more readily available than, pediatric sleep specialists. And so really helping to empower them so that they can recognize those disorders, not to treat them, but to know that, okay, I need you to go because this is a red flag. This sounds like might be sleep apnea. This sounds like there might be an underlying medical condition. I'm going to move you forward to where you're, to an expert that can take care of that issue while I continue to provide the support. And so I think that's just an incredible framework. And I just really want to thank you for doing that. So how do people join this program? Is it like a course? Is it like coaching? What exactly is it?
So it has a combination of like a group coaching component and content that gets stripped over a 4-month period. And then we're going to, the program sort of spans over 10 months. We have some mini trainings that we do with the sleep consultants after the actual program content is dripped. And what that looks like is, having some guest speakers or expert speakers come in to, develop, to really show them an approach to different topics and different subjects. So it's really like I'm in the process of getting that together. It's been really exciting, and like I think it's something that sleep consultants, a lot of them do embrace, and they've been really supportive and excited about the project. So yeah, basically, if in my bio there's a link that you can get to in order to get find out more about it and apply if you're interested.
Perfect. And folks can also probably email or reach out to you directly, and I'll put those links in the comments as well. This is just so exciting. So again, we're chipping at this slowly but surely. We're creating an awareness of sleep issues in kids. We're providing information. We're treating them the best way we can, but we're also educating those around who can help be that sort of front line when it comes to addressing sleep issues in kids. And I think that's just such powerful work. I'm really excited to see how this turns out. So Yeah, absolutely, absolutely. Thanks for coming on. So where can we find you? Where can we work with you? I know you mentioned the link in the bio for the SHIP program, but if
Yeah.
anyone wants to just learn more about the work you do, how do we go about doing that?
Yeah, so I mean, I'm on the Sleep Gap, and I get lots of DMs. Like feel free to DM me if you want more questions, or I actually have a website that is being launched in a few days, and I'm going to chat a bit more about that closer to the time because SHIP is just one. I think when I started this, and in general, my general philosophy is that if you're going to dream or if you're going to action something or do
Mm,
something, just do it. Do it with the most, and
mm,
just put it all out there. And so
mm.
SHIP is just one part of like a larger and grander vision. And
I
so
love
I'm
it.
really, yeah, really excited to share, what else we have coming up in this space.
Mm,
So yeah, I mean,
mm.
yeah, so Sleep Gap is the best place. And then from Sleep Gap, I'm going to be talking a lot more about the other initiatives that we're going to be involved in. It's
Oh my
very, very exciting.
gosh, that is exciting. I love a woman with big dreams. And when I see a woman with big dreams, I'm thinking she is sleeping well. She is prioritizing her sleep because that is behind every woman who is crushing it and getting it done. She is sleeping well. Can you tell me, not to put you on the hot spot, but I know you're an advocate for sleep and you're a role model for sleep. What is one thing that you do that has helped you prioritize your sleep to really optimize your performance, your productivity, and has helped you really move so quickly in this space and in all other things that you're doing?
Yeah, I have to plan it. And so,
Mm,
there's without it actually sometimes goes into my list of like my daily, or weekly plan, like in my agenda, because um, you know, things busyness changes and fluctuates week to week.
mm.
But for me, having being committed to plan and prioritize it every night is what I think is my go-to.
Yes, that is the answer.
Yeah.
And I did not tell her to say that. That is, you have to prioritize, especially when your dreams are so big. Sometimes our dreams are so big that they consume us and they consume
Oh
our
my God.
sleep
Yes.
and they
Yes. Yes.
consume
Yes.
our health.
Yes.
And then we start to hate those dreams. But
Yes.
we have so much to accomplish that we cannot afford not to prioritize sleep. So thank you for doing that. Thank you for prioritizing sleep. Thank you for showing up in this space. And really, it's been incredible talking with you. And I hope you guys got just a glimpse of what is possible as we bridge this sleep gap. And if you're a mom out there who is struggling with balancing it all, where you feel like you're juggling all these balls in the air and none of the balls include sleep, or if you are trying to figure out the sleep thing to optimize your performance so that you could live this incredible life that's similar to the life that Dr. Anya is living and crushing all her goals, then you definitely need to reach out to me. I'm going to put all the links, including the link to SHIP, Sleep Gap, and all that in the comments as
Thanks,
well.
Sophie.
Thank you so much.
Thank
See you,
you.
everyone.
Take
Bye.
care. Bye.